All right, guys, so we are taking a look here at the tray setup for piercing. Now, keep in mind, this is just a very basic setup. Technically, all the items here are majority of the items that you are going to need, but some of these items can certainly vary. So, for example, the type of forceps that I have out might not be the type of forceps that you may choose to use, depending on the certain area of body that's being pierced. Some of these items may or may not be used, but this is technically the setup for all of the supplies you will need for your basic piercing. So first things first, we do have gloves and a mask for ourselves. We always want to ensure that we are following proper infection control. We are protecting ourselves and the client as well. Next, we have an alcohol prep pad. So this is a 70% alcohol. This is what's going to be used to cleanse the skin prior to piercing. We then need to disinfect the skin. So we do need to use what's called an antiseptic. Now the type of antiseptic that I use is chlorhexidine, and it does come in a swab. I do like to use the swabs better than wipes because then it just prevents my fingertips from kind of touching the area. We should have on our tray setup sterilized gauze, sterilized Q-tips, and that is technically for if there's any bleeding at the end of the piercing, we can clean up the area safely. So sterilized gauze, we can pre-purchase gauze that is already sterilized from manufacturing, or you can simply choose to make your own little packages here like I do. So what I do is I go ahead and I sterilize the gauze and the Q-tips, and I put in a sterilization pouch to seal. If you make note, I also have a rubber band in there. So technically your instructor is going to go through with you in theory what a rubber band can be used for, but I do have it already preset in my packages just in case I need to use it. It is utilized for forceps. Next here, we do have a packet of lubricating jelly. So sometimes we do need a little bit more assistance when trying to push through a needle or to get through the jewelry after being pierced. So sometimes we do want to use a lubricating jelly just to allow for that needle to glide a little bit smoother. Now, make note, these are pre-packaged, one-time use, and the lubricating jelly is sterile, okay? So very important, everything we're using again is sterilized. We do need to have our marking pen, okay? So this is going to be a surgical marker. Now, technically, surgical markers should be one-time use. So we should dispose of the surgical marker after we are done with it. We do have our needle here, okay? So needles are pre-packaged, pre-sterilized. Your instructor will be teaching you in class the different needle thicknesses, the needle gauges, in regards to what we need to use for certain pierced areas. We have an item here that is called a receiving tube. So it is a plastic tube that has been pre-packaged, pre-sterilized, one-time use only, okay? Now, your instructor is gonna be indicating to you when you would use a receiving tube, but technically it is to ensure that the needle has a place to go without kind of puncturing any other tissue on the other side. So it's receiving the needle as it's being pierced through the tissue. Receiving tubes are not always used. There are certain situations where we do need to use them. This here is called a needle taper. So it looks like a needle, but it's not. So what this tool is used for is to insert the jewelry, okay, after the skin has been pierced. So this item here is reusable, so it does need to be sterilized and packaged for the next use. We then have our forceps, okay? So not every piercing procedure is going to require forceps. And certain piercing procedures require different forceps to be used. You are going to learn all of this in class. Your instructor is going to indicate to you what type of forceps are technically used in the industry with different areas being pierced. Then we have our jewelry, okay? So jewelry, your instructor is gonna go through in class the different types of materials that are safe to be used for initial ear piercing or any piercing, materials that are not safe to be used. Now, regardless, we do need to ensure that our jewelry is sterile. So once you do order jewelry, from a company, it is more than likely not going to be sterilized. So once you do receive that, you will have to sterilize it and ensure that you do pre-package your jewelry. Okay. And then last but not least, we just have a piercing aftercare on the tray setup, and your instructor will go through with you in class the different options of aftercare that can be given and also retailed to your clients.